my assignment is very, very simple. Is to welcome you to this OpenMRS conference, OpenMRS 2024. And as you may realize, this is a conference that is in Nairobi, Kenya. In case you forgot, you actually had to come into Kenya and then come into Nairobi City. So welcome to Nairobi. But before we go there, I want to see your phones, okay? So I want to see your phones because we want to play a short game just to make sure that you feel welcome, okay? So what I want you to do, just get your phones out. Don't go to TikTok yet. We'll go there later. Don't go to TikTok yet. Don't go to X. Just look for your QR code scanner because we are going to play a game, okay, this afternoon. Do you have your phone in your hands? Okay. So the first thing that we are going to do is to scan this QR code. And I want to see the person who will tell me what it is about. The first person to tell me what it's about can tell me. Okay. You may or you may not get an award, okay? Okay, so that's a QR code for your Wi-Fi, right? So if you had not scanned this QR, now you have access to Wi-Fi, okay? So you can now go to step 2, okay? So now the next is this one. Okay, who can tell me what that is? Consent form. A disclaimer that if you are in this room, there will be pictures taken of you, okay? There will be CCTV cameras looking at you, and we need your consent so that when you see your picture on TikTok, you don't say you didn't know. So please take a second to just consent for your picture to be taken so that we are all on the same page, right? Data protection is real, right? Okay. Now, we can move to the next if you have already done that. Please make sure you do. Some of you already did it when you came in. Now, we go to the next one. So now, in Kenya, we say there are only 3 things. In Swahili, we say, I didn't hear. You know, I used to be in the choir. I sing very good tenor, and I won't start now. So I want you guys, let us, it's a chorus, okay? Mambo ni? Which means there are only 3 things. So the first thing is to welcome you to Nairobi, Kenya. Now, in this QR code, you will find your what? Yes, you will find your guide. There are a number of documents in that link. Please, if you can just mark it for this week, so that then you can be able to see what we are talking about. We brought this conference next to the airport, so that on the last day, after having your fun in the city, when you come back to your hotel, you'll actually be heading home, okay? So please take time. Nairobi is the city that has a national park within its precincts. It's just a walking distance from here. We have a lot of entertainment spots. Please take a moment to find out where they are so that you can be able to find your way around. There are malls around this place. They're easily findable. If you need to change money, there are actually places that you can visit. So now that we are dispensed with the basics, so I want us to move on to the next thing, which is what brought me here. So welcome to the OpenMRS conference, OpenMRS 2024. Our hashtag, by now, I believe you all know it. So please take a moment to tweet, go to LinkedIn, and hashtag OMRS24, so that then we can be able to have a very, very successful conference over the next 5 days. The next one is the third, okay? OpenMRS conference, this is not the first time Kenya is hosting it, Sindio? Sindio means, isn't that, is it true? I'm not a Swahili speaker, a very detailed Swahili speaker, but we hosted OpenMRS in 2014, okay? I know the University of Nairobi, MoH University has representatives here. In 2018, IntelliSoft hosted us, and this time we are having Palladium as the host. So we are co-hosting this with the Ministry of Health and feel very, very welcome to this OpenMRS conference. And then the third item, which is the last one of my session before I invite everyone back, is to welcome any new persons to the OpenMRS community. And I'd like our MC, once we are done, once the dignitaries open the conference, we need to celebrate new members. Dr. Manya, you're welcome to the OpenMRS community. I know you have been a member of the community without knowing or knowing, but we welcome you officially to the OpenMRS conference and the entire Ministry of Health, because we have adopted OpenMRS as a country for our digitization efforts. So MC, I've given you an assignment. So finally, I'll give it back to the MC so that we can invite our first speaker for the day. This session has two sessions. They are the opening remarks. Then we will have a plenary session that will follow thereafter. So I'll give it back to you, MC, so that then we can go to that first one. Thank you.
I take this opportunity to welcome you to Kenya. And I'm not following many protocols because I've not been with you throughout, so I don't know how many countries are involved and other people, but I appreciate all of you. I would like to start by just a small speech. We all know that there has been an overwhelming growth of digital solutions utilizing advanced technology to improve health systems. Kenya has made tremendous efforts in adopting digital solutions. OpenMRS-based systems were among the first electronic medical records to be adopted in Kenya. Digital health governance is an important driver for any digitalization efforts. We've developed comprehensive policies and regulations to ensure that the digital technologies are used ethically, securely, and effectively in healthcare. Notable acts of parliament include the Data Protection Act of 2019 and the Digital Health Act of 2023. The Digital Health Act established a digital health agency, which will be the custodian of digital systems. Other digital health enablers include the publishing of digital health standards and setting up of fundamental guidelines for certification of digital solutions before adoption in the country. Arguably, the enabling legal and policy environment has been instrumental in the growth of various systems, including OpenMRS. The government has also come up with an innovative vision and actually come up with what they are calling digital superhighway. The digital superhighway comprises several initiatives to strengthen the government's health information system. A key component of the digital superhighway is data sharing through interoperability standards. The superhighway also takes care of telemedicine and financial activities like insurance claims. To fast-track the digitization agenda, the MoH is investing heavily in the required digital health infrastructure. For example, coming up with hosting services and internet connectivity. They have also invested in capacity building and actually in the user support. But despite these efforts, we are aware that some regions in the country may have poor connectivity. This digital divide might have some challenges. We hope that this has not adversely affected the implementation of OpenMRS in your countries. Among the key digital initiatives being implemented by the government are the various electronic health records. And to this, we have actually been among the MoH has approved 4 electronic record systems for rollout in Kenya, and Kenya EMR, which is based on OpenMRS platform, is one of them. Today, as we launch the OpenMRS conference, we urge countries, faith-based organizations, and private facilities to partner with us in this digital transformation agenda. We are certain that by leveraging the strength of partnership, we will make significant strides in realizing our vision and strategy for the digital health transformation. As we gather here, we must celebrate the power of communities. To effectively utilize digital solution, capacity building is important. In a country where resources are constrained, we believe adequate capacity building of available staff through a community of practice can reduce costs. Experienced people in the community can teach others, reducing the cost of traditional schooling. Ladies and gentlemen, I am taking this chance to welcome you to Kenya, which we can now proudly call the home of OpenMRS. Many of you know that OpenMRS was born here in Kenya. It was designed and by a team of clinicians and software experts working in Eldoret and abroad. Driven by a great need to digitize and automate service delivery, the founders of OpenMRS desired to develop an electronic health record system capable of handling data in the health system. The system has grown rapidly, leading to the establishment of a global OpenMRS community, and arguably, the founders are happy that their vision has been realized, and that is why we are here today. I've been informed that some of the founders and many of those who have been part of the OpenMRS journey are here with us today. I think we should take a short period just to clap for them. Yeah, in Kenya, the HIV program was the early adopter of the OpenMRS-based systems, such as AMPATH and Kenya EMR and eHospital. Through funding from PEPFAR, we've developed this system. We've served over 2,300 AIDS facilities and dotated more than 90% of patients on antiretroviral therapy are being supported by the system. Besides the HIV management, the system has been expanded to become a fully fledged electronic management system. As the country moves towards digitizing health records, Kenya EMR is very happy, is moving very well, and we are glad that it will be the main backbone of this country. And we hope with your support, we'll raise the flag of Kenya EMR to the greater heights. Like all sub-Saharan countries, Kenya is shifting to universal health coverage. The UHC involves empowering individuals to access affordable healthcare, and digitization of health services has been identified as an enabler for the UHC program. As I conclude, the digitization efforts in Kenya, supported by initiatives like OpenMRS, are pivotal in achieving universal health coverage. These efforts not only enhance healthcare delivery, but also set a precedent for other nations to follow. As I welcome you all to Kenya during this meeting, we recognize and appreciate your contribution to the digitization journey. Kenya commits to continue sharing back to the OpenMRS community in line with the best practices. We look forward to hearing the outputs of the community hackathon and lessons from implementers to guide Kenya's digitization efforts. We welcome you to share the Kenya hospitality experiences, including the unique attractions in Nairobi. You've been told before, you make sure you get some evening drive to the national park. And I remember one day I was in some countries down south, there is a restaurant called Hungry Lion. In Kenya, we don't have the Hungry Lion as a restaurant, but we have real lions nearby. So you should try to go and look at them. But make sure you don't move near because they're actually also hungry. So you should also take time to look at our culture. We are a friendly people, and as we put it, hakuna matata. I also just want to put my small efforts, because this has been prepared for the PS. I just want to say that I've been in the digital journey for quite some time. I've been mostly involved with the development and implementation of the District Health Information Software, the DHIS. And we think the DHIS has brought us this far by highlighting the importance of electronic records. And we think to close this gap, we need a very robust electronic medical records. And as from my personal view, I think the OpenMRS is going to be the game changer in this new field we are going. part of the things that we look forward to is to improve the analytic outputs of the system so that we are able to talk to the policymakers, give them the data they need, and maybe, just maybe, get away from the old traditional school of reporting. We just need to have data somewhere, and whenever you need it, you are able to maybe even use the AI tactics of getting data wherever you are immediately. And so that data will not just be there, created to be sent to whoever they are sending it at the end of the month. But data should be able to be used almost immediately it is created. So that is the dream that we have. And at least if we do this, we'll have revolutionized the culture of information systems. And it's just not just information systems, but eventually the information systems support the improvement of healthcare. And most of us are here to improve the lives of our fellow people. And to this, I take this opportunity to officially declare this officially open. Thank you.